Okay, so let's jump right into this bow tie question together, and I'll read this out to you. I know it can be hard to see on the screen. So we have our instructions, and it says complete the diagram by dragging from the choices below to specify what conditions the client is most likely experiencing, 2 actions the nurse should take to address that condition, and 2 parameters the nurse should monitor to assess the client's progress. Okay, and then we see that we have our potential conditions in the middle that we'll tackle first, and then our actions to take and parameters to answer. Now, I want to point something out here. You all see this most likely items. So when we are given most likely, you see here what the client's most likely experiencing, it means that we're going to be given information that make all of these things possible, that in a situation it could be this, but there's something else telling us that it's likely not that condition. And so we have to determine based on all the information what is most likely happening. Okay, so here we have our data tabs. We have a nurse caring for a 34-week pregnant client. The nurse reviews the health history and vital signs from 0900. In our health history, we see a client is 34 weeks pregnant, a G3P2, and being seen in the obstetrician's office for a routine prenatal appointment. She reports experiencing mild lower abdominal cramping and small amounts of bright pink vaginal spotting yesterday evening. She also notes recent occasional dyspnea, and the client reports a mild headache for the last 2 days and not feeling the baby move very much today. As we look at our vital signs, we see our temperature here is 98.2. We have a pulse of 80, respirations are 20. We see blood pressure is 122/81. Our pulse ox 97%, and then we have pain, which is 2 out of 10 headache. Okay, so this first step in our clinical judgment is recognizing the cues. So what matters most? So what do we see here that is concerning or what's not concerning and maybe normal? Do you see anything concerning here? And feel free to just drop it in the chat box there. So I'm seeing that this client is 34 weeks pregnant. So that would mean that she's preterm. What other things do you all see? We have mild lower abdominal cramping. What do we think about that? Mild lower abdominal cramping, and we have this bright pink vaginal spotting. Is that concerning to anybody? What about, we see this occasional dyspnea. We see mild headache. So lots of different findings here. What about in our vital signs? Do we see anything concerning there? So I see that her respiratory rate is slightly elevated, but is that normal in pregnancy or is this concerning? Is there anything else telling us it's concerning? What do y'all think? So when I look at this, I'm most concerned here about this client being preterm. I see we have internal bleeding, somebody thinking, so possibly, but with internal bleeding and pregnancy, we would have horrible pain, right? And this client is just experiencing this 2 out of 10 headache. Yes, so 34 weeks pregnant. So we see she's preterm. And I see this mild lower abdominal cramping and bright pink vaginal spotting, and I'm a little concerned here about some preterm labor. Placenta previa, I see that could also be. So excellent. 20 respiratory, now I'm seeing all your comments. Respiratory rate normal. Okay, so let's take a look and see at each of these choices and figure out what exactly this client is experiencing. So